Hello everyone, good evening, and I'm Sridevi from Prostate Wellbeing team. I'm sure all of you must be keeping in good health. Please vaccinate yourself when you get your chance and also do wear a mask when you venture out in public. Today we are going to discuss a very important topic, prostate cancer. Prostate cancer develops in a man's prostate, the walnut-sized gland just below the bladder that produces some of the fluids in the semen. It's the most common cancer in men after skin cancer. Prostate cancer often grows very slowly and may not cause significant harm, but however, some types are more aggressive and can spread quickly. Let's unite to raise awareness about prostate cancer and its impact in the life of people living with it. To throw more light on the subject and guide us on what is right in terms of diagnosis, treatment, and the well being of prostate cancer, today we have with us Dr. Shrikant Badwe. Dr. Shrikant Badwe is a renowned urologist and andrologist practicing at BK Kidney and GI Center, Goregaon, Mumbai. Dr. Shrikant Badwe has about 20 years of very rich experience in this field of urology and andrology, and he carries out treatments with utmost precision, efficiency, ensuring that the patients are in safe hands. We are very, very happy and privileged to have him with us today. Namaskar, sir.
Namaskar.
Very, very glad to meet you, sir.
Thank you for such a nice introduction. Let's go ahead. Yeah.
That's you're very humble, sir. Anyway, thank you. And sir, when we talk about prostate, first, could you tell us what a prostate is?
Okay. See, prostate is a gland which is found only in males. Obviously, it is not found in females, and that is a walnut-sized gland which is situated between the bladder and urinary passage. That is urethra, which we call. That is urethra which goes through the penis. So it is situated between that. It is in front of rectum from where we pass our stools. So it is front of rectum. It is below bladder. And the function of the prostate gland is to it gives secretions which will enhance the ability of the sperms to impregnate or to fertilize the ovum. So it is actually speaking, the contents of the prostate fluid are enriching the semen which comes from, or sperms which come from testes. And at the time of ejaculation, the prostatic fluid comes in that semen, and it is a nourishment for the sperms.
Okay, sir. Great. So when you tell about prostate, so what do you think is the actual problem of a prostate, and how can we find it out at home? Like, what are the first symptoms that we see in our prostate issue?
Okay. Now, this is a very important question because prostate is associated with majorly two important issues as the age advances. Number one is simple benign enlargement of prostate, wherein the patient has some amount of obstruction to the flow. They feel that partly they are emptying the urine and not full emptying of bladder is occurring. They have some amount of, dysuria, that is painful micturition, burning micturition. Part of the urine remains inside, so it gets infected. They can get infection. And the terminally, when the gland is very big or when it causes retention of urine. This is a routine thing, which is a age-related, senility-related natural history of prostate gland. It is hormone-dependent gland like uterus in females. Uterus is hormone dependent. Similarly, prostate is also hormone dependent. So as the age advances, the prostate gland enlarges and it causes obstruction to the urine. And sometimes then, like if the lot of urine remains inside, it can cause infection of the urine. All these things are natural history. Most of the patients, elderly patients, will suffer from this. Now the question is malignancy of the prostate or cancer of the prostate. One must remember today, just now, the take-home message for all the listeners is in the initial days of prostate cancer, there are no symptoms at all. All these symptoms are similar to symptoms of, benign or simple prostatic enlargement, which is non-malignant. So malignancy in the initial stages, 80% of them will not have any symptoms. And those who have symptoms, of which 20% could be harboring prostate cancer. So prostate cancer, one has to look for it. It is a question of diagnosing it by proactively, by going ahead and doing something special. And in that, there are some tests we do routinely after the age of 50.
Okay.
And those patients who have history of prostate cancer in their family, like father, brother, uncle, cousins, all of them, then this evaluation or this finding out for the prostate cancer, all these tests are started little early at the age of 45 only. But after the age of 50, one has to look for it. It will not come to you because when they come to you with symptoms of prostate cancer, it is an advanced disease. In advanced disease, it will involve the urethra, it will involve and it will cause bleeding, it will cause obstruction, it will cause metastasis in the bones and it will give bone pain in the hip joint, in the spine. Then sometimes in a late stage, those metastatic bony lesions in the spine can give rise to fracture of the spine also, compression fracture, fracture of the spine, or fracture of the hip bones also. So all the symptoms of prostate cancer, they come in a late stage. In the early stage, the urologist or the patient has to be aware of it and urologist has to look for it. There has to be a great significant awareness for prostate cancer.
Okay, sir. Thank you for that. And how common is prostate cancer in our country, sir?
See, basically, people used to feel that this prostate cancer is very common in European countries or in the Western world, so to say. And in Asian countries, it is quite uncommon. But which is not true. Now,
Okay.
in Bombay, Chennai, Pune, in many of the places, the cancer registry has started showing that prostate cancer is increasing with leaps and bounds. One of the important reason is our people, this one population is aging now. They are living longer. So once they live longer, then the chances, because the first and foremost, criteria for prostate cancer is age. Age is the main thing. So as the age is advancing, number of prostate cancers are getting diagnosed more. And second thing is that once there is awareness of finding out for looking for prostate cancer, the diagnosis of prostate cancer is becoming more and more. And such kind of diagnosis in such situation, always these patients are diagnosed early.
Okay, sir.
For it, you can diagnose it early. If you don't look for it, then they would always present very late.
Right, right, sir. So you told us about the age being the main factor. But apart from age, what are the other reasons why one could develop prostate cancer?
See, one of the reasons, as we said, the important thing is age. Second one is, family history. Those who have a
So it
family
could be genetic also.
cancer, then they have a 2.5 times, 2 times, 3 times more chances of developing prostate cancer. Another thing is that there are a lot of things which have been discussed about. Like one of the thing is, like in breast cancer, they have found out that BRCA genes, if they are found, they are more prone to have breast cancer. Similarly here, BRCA2, these kind of genetic findings, they would make them more prone to have prostate cancer.
Okay, okay, sir. So,
Here comes the question of, then how do you prevent it? So in
right.
prevention, there is nothing that has been proved. People used to say that tofu, selenium, all these things would prevent. Then they would say that, having a red wine will prevent it, or having, extra sexual life or sexual act will prevent it. But none of these things have been proved in a larger major studies.
Okay, sir. Okay. And obviously, men are the ones who are prone for prostate cancer. But do you think there is a separate segment of men who are, capable of being affected more?
That's what I said. Age is the one of the factors. Second one is family history, as I said. But otherwise, there is nothing that has been proved that, that is the one which will cause prostate cancer. Nothing.
Right. Okay, sir. And could you also tell us about the symptoms of the prostate cancer once again?
As we discussed just now, initial stage when the prostate cancer is localized into the prostate only and it has not spread anywhere, the symptoms of prostate cancer are hardly any. Those symptoms are, like mild dysuria, that is painful micturition, burning, or little bit of obstruction. But all these symptoms are associated with benign age-related prostatic enlargement also. So symptoms of prostate cancer, when it should be diagnosed in early stage, they are almost nil, no symptom.
Okay.
If it gets advanced, one of the commonest place where it gets, spread is large bones like hip bone, large bones on which we walk, or spine. And all these bones, if there is metastasis, that will give rise to symptoms of pain, fracture, etc. Similarly, it spreads to lymph nodes. And in the later stage, in late stage of prostate cancer, they will develop, edema of the feet, swollen feet, or in fact, in advanced case, there will be swollen penis and scrotum also. So that is because of lymph nodes. And
Okay.
sometimes, if it is diagnosed very, very late, it can, eat up the urinary or the ureters from where the urine comes, and it can block the kidneys also. But these are all late stages.
Okay, okay. Thank you, doctor. That was for one of our viewers who wanted to know it again. And also, there are some issues like erection problems or urinary incontinence and
That is
loss
in
of bowel
advanced stage.
control.
Yeah, it was in advanced stages, absolutely advanced stages. It will give rise to, metastasis in the penile urethra also, penile shaft also. Then it will give rise to blood in the semen also. It can give rise to erectile
Okay,
dysfunction, blood in the semen. And if it advances and it causes obstruction, large gland, as I said, it is lying in front of rectum. So that large gland will give rise to, rectal symptoms also. The rectum will get blocked, constipation, and all those things will happen. And as I said, still further, if it grows into the bladder and eats up the bladder mucosa, and it reaches the ureteric orifices from where the urine comes from both the kidneys, then it can give rise to obstruction to the urinary, both the kidneys also, tubes.
okay, okay, doctor. So, as far as prostate is concerned, you first mentioned about the normal prostate issue. So, is it true that the ones who face a normal prostate issue would only end up facing a prostate cancer? Is it something like that, sir?
Not at all, not at all. See, normal prostatic enlargement, prostatic symptoms are far, far, far more common with the age. The
Mm.
CA prostate will not be that common. Amongst these patients, we have to look for it. We have to do some special test to find out if there is anything which is happening in prostate and whether it is malignant prostate. And there
Okay.
are two tests which are need to be done. One is, examination by a good urologist. And what he does is DRE, digital rectal examination. He puts his finger into the rectum and starts feeling the prostate. As repeatedly I have mentioned that it is in front of rectum. So once you put your finger inside, you can feel the prostate anteriorly in the front. And if there is any abnormal feel in that prostate gland, like, hard nodule or complete hardness or little hardness, then that is a suspicion. But apart from that, another one blood test is done, which is known as PSA.
Mm.
PSA stands for
Yes.
prostate specific antigen. It is
Okay.
an extremely important test. By invent Once the PSA was invented in the Western world, what they found that initially in those countries, 70%, 80% of them were diagnosing the prostate cancer late. Now, in those countries, the early diagnosis is in 80% and late diagnosis is in 20%. In our country, even today, 70 to 75% of the patients, they get diagnosed late because they don't look for it, they don't do these tests. So these two tests, like digital rectal examination and prostate specific antigen, that is a blood test. These two are extremely important. For PSA, you need not be starved. So I always tell my colleagues and my friends and junior doctors and everybody that when the patient comes to you and if he has symptoms, then and then only you can collect the blood. It is not necessary to bring him to ask him to come next day morning starved, because PSA test does not require starvation.
Right, right. Okay, sir. Thank you for that. And when you talk about prostate cancer, does it also any kind of cancer, in fact, definitely affects the mental health of many patients. but more so with prostate, because it becomes very difficult for them to venture out to they can't find bathrooms where they go. So from the initial stages they go through these kind of issues where they feel it's a social stigma, they can't talk to people about it. So is it important to give them counseling that in that way also, sir?
Yeah, counseling. See, now most important thing, let us focus on PSA and digital rectal examination. This
Okay.
PSA test, every time, if the PSA is high, it doesn't mean that there is prostate cancer. PSA can be high in a benign prostate, which is enlarged significantly. It can be high because of urinary tract infection, which is very common in these patients. And if they are diabetic, it is far more common. So urinary tract infection also can raise the prostate, this one PSA. Any catheterization, suppose somebody goes into retention, but if he requires a catheter to drain the urine, after that, obviously the PSA after catheterization, PSA rise, would be seen to be significantly risen. But at the same time, these are all, once you find that the PSA is high, you rule out if there is any infection, you treat that infection and repeat PSA. And if the PSA remains high, then further investigations are required. So basically, PSA is abnormal and digital rectal examination, PR examination is normal. Still, you go ahead with further investigation. DR examination is normal, that is, rectal examination is normal. And if the PSA is within normal limits, even then you go for further investigations. And if both are abnormal, obviously, you need to do further investigations. And nowadays, the most important investigation which is done is MRI of the prostate. And in that, a special MRI is done, which is known as MP-MRI. So this MP-MRI is suggested by a urologist when he suspects that there could be a prostate cancer. And obviously, after that, we need to do biopsy of the prostate.
Okay, doctor. Thank you. And one of our viewers has a question. Does this involve chemotherapy?
See, initially, good old days, matlab 10, 15 years back, there was no chemotherapy available for prostate cancer. This cancer is completely dependent on hormones, that is male hormones. So male hormone is testosterone. So it is completely dependent on testosterone. That is prostate cancer's oxygen. That is the food for it. So once you get rid of testosterone from the body, this cancer can come under extremely good control. And there were days when all of them used to undergo this testosterone ablation from the body. And that was done by removing both the testes. Once you remove the testes, testosterone is gone. Or nowadays, there are good number of variety of 2 or 3 types of injections which are given, and that will suppress the testosterone in the body to a very, very low level, and it will control completely the prostate cancer. However, this effect of this testosterone ablation, removal of testosterone, remains for certain length of time. And after that, this gland, it becomes rebellion, cancer, and then again it starts, growing. So apart from testosterone ablation, we do have chemotherapy, we do have radiotherapy for prostate cancer. But it is used only when this cancer is spread over other parts. In initial phase, when it is absolutely localized to prostate, the best treatment is removal of radical prostatectomy, complete radical removal of the prostate gland. Now, this radical prostatectomy can be done in 3 ways. One is, regular open surgery. Second one is laparoscopic surgery. And now people are aware of it. For prostate cancer, the well-known surgery is robotic surgery, removal of the prostate gland by robot. Remember one thing, all these surgeries, what I'm talking about is only and only when the disease is localized into prostate cancer, prostate gland. Once it goes out of it, then you require these kind of other therapies in the form of, testosterone removal from the body by injections or by surgery, removal of the testes. Second is, there is variety of chemotherapy available, where radiations are available. Radiations are of different types. One is, externally the whole prostate is radiated, or inside the prostate we put some seeds through which the prostate gland gets radiation. But these are all for advanced disease. Our aim is to diagnose them early and as far as possible, offer them radical surgery.
Okay.
Obviously, if the patient is very old, if he is moribund, diabetic, elderly, then in that situation, instead of radical prostatectomy, there is a good radical or curative radiation therapy also available.
Okay, sir. The next question is from Mr. Rohit John. He wants to know if he can have a normal life with prostate cancer.
Very much. See, initially in the introduction, you mentioned few things, but which, uh, generally I don't like to say that. Olden days, we used to say that prostate cancer generally grows very slow, etc. But it is not true. Nowadays, what
Okay.
I find that in a younger age group, the prostate cancer is more aggressive. Metastasis is very common, and metastatic prostate cancer is a very bad thing for a patient to have, because it gives them lot of morbidity. There is lot of pain. Quality of life is very poor. So, like one must remember that early diagnosis and early treatment is something which is absolutely necessary. It is not that it will, it will give rise to any, poor quality of life. Even after radical prostatectomy, complete cure is possible. And nowadays, in advanced disease also, good number of medicines are available. Oral medicines are available, chemotherapy is available, which was not there before. Not only that, I must put it here that, like the this one the this one the expenses also have come down remarkably. The drugs are, becoming more and more and more cheaper.
Right, right. Thank you, sir. That was really very reassuring. And Ms. Shivani Mishra wants to know if drinking a lot of water is good for your prostate.
Not necessarily. See, God has given you thirst, so as much thirst you have it. But only thing is that don't neglect and have water in adequate quantity. But prostate cancer development has absolutely nothing to do with your water drinking. It has no
Okay.
relationship at all. It,
Okay.
for general health, it is all right that you drink more water and keep yourself hydrated. And of course, everybody knows about it. Is there are some conditions in the body, like cardiac conditions, etc., where in fact you are not supposed to drink more water. If the kidneys are not functioning properly, absolutely there is severe restriction on your fluid intake. Those who have bad kidneys and those who are having high creatinine, they are asked to have only 800 to 1200 cc's of water per day. Cardiac patients are advised like that. So it is not a blanket rule that drinking more water is good.
Right, sir. And Abhishek Sen wants to know what are the four stages of prostate cancer?
Okay, that's a good question. See, as I said, localized disease, that is stage one. Then it causes it, first of all, sometimes the prostate has two lobes, right lobe, left lobe. And if there is disease in the one lobe, then it is highly localized. Then disease in the both the lobes, but still it is localized. So that is initial stage. Then it goes through the capsule to surrounding structures. One of the most important surrounding structure is seminal vesicles. That is the one which, if gets involved, it can cause, hemospermia, like blood in the sperms. So that is second stage. And after that, third stage is wherein it goes to lymph nodes and bones also.
Okay. Okay, sir.
And
What?
last, very
Hmm.
rarely, it goes to various organs also, like liver and other things, chest, etc. But commonest is bones and lymph nodes.
Okay, sir. What is the stage of watchful waiting?
Oh, watchful waiting is a word which I feel that for our continent, it is not something which is very interesting. The reason being,
Okay.
watchful waiting is meant for only exceptionally highly affording class of people. In the sense, when they do biopsy, we categorized it into Gleason score. There is something called Gleason score, which starts from 1 to 10. So Gleason score between 1 to 6 is considered to be, up to 6 is considered to be nearly no cancer. So even if it is Gleason 6, these are the people which generally are kept on watchful waiting. But watchful waiting is extremely difficult to follow because they require on regular basis their PSMA PET scan. They require regular scans, and PSMA PET scan is expensive. It gives you information about the spread of the prostate cancer, and you require to go to your doctor very regularly. But watchful waiting is is advised in absolutely initial prostate cancer, which is localized, but not only localized, the Gleason score, the grade of that cancer, the intensity of that cancer is low. In that situation, watchful waiting is done, but watchful waiting is a difficult thing to follow.
Right. Okay, sir. Thank you for
It is interesting to, the word is very interesting, only watchful waiting, but it is not so. It is not easy to have watchful waiting.
Okay, sir. Miss Pani Kumar Sameta wants to know, post-COVID patients who have recovered from COVID, what kind of prostate problems could they face?
Nothing specific. See, basically, prostate cancer and COVID is an infective thing, and prostate cancer, is totally independent of this COVID. So, prostate cancer with COVID, there are nothing like specific things that would specially happen to prostate after COVID. Nothing.
Right, right, sir. Um, who should I contact about any side effects if I experience, and how soon?
About side effects of what? Treatment? What is it? Side
Yes,
effects of
about the treatment,
about
maybe.
the
Yeah.
treatment. Huh. Hey, the thing is that, see, basically these radical prostatectomy, post-radical prostatectomy, many of them, they have some kind of incontinence of urine. So obviously somebody who has done your surgery, he will look after it. And chemotherapy and this hormonal therapy, they require follow-up, like, going to your doctor regularly. The reason being, after this hormone, testosterone ablation, people do have increased incidence of cardiac events, or increased incidence of osteoporosis. The bone density goes down. So generally the doctor who prescribes you all those things, he would give supplements for that.
Okay, doctor. What types of surgeries are available for prostate cancer?
That initially I discussed. One is, open prostate. This is for localized prostate cancer. There is surgery which is available. One is, open prostate. Second one is laparoscopically. That is through the telescope, you go inside the body and do surgery. And third one is robotic. Nowadays, robotic is in quite a fashion, and robotic has some few advantages. However, take home message is extremely important. Take home messages. In our country, there are only 60 70 robots, and not that everybody would be having access to robots, but a good quality of open surgery is far better than, done very well, is far better than a novice or poorly done robotic surgery. So any surgery, robotic or open or laparoscopic, which is done with keeping the basic principles of cancer surgery, the results are same. And second
Okay,
thing
sir.
is that prostate surgery, probably the question which has been asked, because it may be that the patient might be having some little, metastatic disease, and the other surgery which is commonly done is removal of the testes. That is done to get rid of the testosterone from the body, that is male hormone. And this can be done by removing both the testes, that is the permanently, getting rid of testosterone from the body, or it can be done by giving some injection which will suppress the testosterone in the body. These injections are available on monthly basis, every month one injection, or tri-monthly basis, or 6 monthly basis also. People generally take 3 months dose. We have to repeat it every 3 months. We have to monitor the PSA, because after doing the PSA will come down, testosterone levels will come down. And in this situation, one must remember that after few years, they become hormone resistant. They become resistant to this treatment, and again the prostate cancer starts, flourishing in the body. So that is known as CRPC, castration resistant prostate cancer. That means after removal of the testes also prostate cancer is increasing, or it is known as HRPC, hormone resistance.
Hmm.
I'm giving injection to the patient. Then it is, so in that hormone resistant prostate cancer. You got my point, when he is on injections. Okay.
Right, sir. And Mr. Rahul Vishwakarma wants to know if there are any changes that he needs to do in his diet.
Okay. Now see, just now initially I just made a passing reference that diet ke bare mein. In that I said that tofu, selenium, these were the two things, or vitamin E. These were the things which were discussed, and there were some reports saying that if you have tofu in diet or selenium, if you take regularly, in fact, in Western countries, in the this one supermarket, the selenium tablets are available.
Hmm.
These are the things which were discussed. Then secondly, people said that if you have regular red wine also, it can prevent prostate cancer. But none of them have been proved. But one thing is certain: prevention of prostate cancer is only by maintaining your weight, then
Okay.
having fruits every day, absolutely every day, like 2 or 3 bouts of fresh fruits. So fruits is important, maintaining your weight is important, and regular exercise is important. In short, it is all healthy habits for any kind of diseases in the body in the form of cardiac or diabetic or any lifestyle diseases. Everywhere it applies.
Okay, doctor. And Rohan Poonawala wants to know if this treatment could affect his everyday life. Will I be able to work, exercise, and perform my usual activities?
Certainly, why not? See, basically, in advanced disease, obviously there is restriction on your activities because of pain, because of other things. But in a localized disease, if you undergo a prostate cancer surgery, that is radical prostatectomy, you can have your absolutely regular life. Only thing is that after radical prostatectomy or any radical prostate surgery, for certain length of time, you do have incontinence of urine or less control over the urine, but that recovers in some patients within a month, and some patients will take about 2 to 3 months to recover. But you
Okay.
can have all your activities.
Okay, sir. What kind of follow-up treatments are available?
Follow-up wise, see, anything which you do, even if localized cancer, even if you have done complete cure by removing the whole thing, regular follow-up in any malignancy is absolutely mandatory. The reason being, what we search for is, if there is any recurrence anywhere, like, the prostate gland is removed in the same bed, same area where the prostate gland was removed, there can be, like recurrence of, some small recurrence. Or, like if you are hormone dependent and then some kind of treatment is given, continuously you have to monitor your PSA and testosterone levels. Those who are in a metastatic disease. So all of them, everybody would require follow. And the follow-up, the mainstay of follow-up is seeing their testosterone levels and seeing their PSA level. Because if the PSA starts rising after complete cure, then it is an indication that somewhere in the body it has recurred. And the best investigation which is routinely done is PSMA PET CT.
Okay. Okay, doctor. Does smoking affect my prostate? Is the next question from one of
There is
our
no
viewers.
direct evidence of that, but obviously smoking is bad for your health always.
Yes, sir. And the next question is about alcohol. Do I need to cut down on alcohol if
Not
I'm
really, but as
suffering?
I said, there are few reports in the literature wherein they say that having red wine is good for prostate health also, as much as they talk about cardiac health also.
Okay, sir.
But
And
even in cardiac health and not even in prostate, it has been proved in larger, good, double-blind controlled trials, proper.
okay, sir. So the next question is from a viewer. She says he says he has a problem with his kidneys and also in the recent times experiencing urinary incontinence. He's about 52 years old and does he have to check on prostate too?
Absolutely. He must check for prostate only. The reason is, even if he has got a benign enlargement of prostate, and suppose because of that the flow is poor and lot of urine remains inside, we call it residual urine. After passing urine, there is incomplete emptying of the bladder. Then these are the patients which will have incontinence. And there is one more important incontinence which is known as overflow incontinence. The bladder is absolutely full. So whatever new urine comes in the bladder, immediately he wants to pass, he goes there and there is no control over it.
Right, right. Could this also lead to bowel control in the bowel movements? There is no control in the bowel movements
Yes,
sometimes.
it can. In an advanced stage, it can.
Okay, okay, sir.
Nowadays, extremely good treatment is available in that situation also. If given that the prostate uh, cancer in the gland, it can regress really well. It can regress very, very remarkable regression of that gland is seen. Suppose if you
Okay.
had a hard gland of like 60 grams, with the
Hmm.
treatment, it can become 15 grams also.
Okay, okay. And is using adult diapers advisable?
Diapers are advised if there is incontinence, but one has to evaluate fully why there is incontinence. So that incontinence needs to be evaluated.
Right.
Diapers is it's not a cause and effect. In the cause and effect phenomena, you are not searching for cause, you are not treating the cause, you are just trying to put a diaper, that's it.
Okay. Okay, sir. Next question is from Shivani Mishra. What are the possible side effects of each treatment, both in short term and long term?
Okay. Now, as I said, if it is a localized cancer and if you do a nice, good surgery, then after that, side effects are hardly any. As I said, initially there could be some amount of, the control on the urine would be less. Some amount of stress incontinence that, like little coughing, sneezing, he will leak, or there can be some urgency, etc. But long term, there are no side effects except that, because of surgery, sometimes there can be narrowing where the prostate is removed and bladder and the urinary passage is, sutured to each other. At that place, there can be stricture which is known, and maybe the person who is asking question in their family, somebody might have had this. That is
Mm.
one. About chemotherapy or hormonal therapy, after hormonal therapy, as I said, it can give rise to reduction in the libido or sexual desire in the long term, or it can give rise to, like little bit of, gynecomastia. That is, in the males also, the breast gets engorged and it becomes little prominent. Uh,
Okay.
that also is after a very, very long time on hormonal treatment. And in chemotherapy, by and large, the chemotherapy of prostate cancer is not that very toxic like other chemotherapies, wherein there will be complete loss of hair,
Right.
or this. But some amount of immunity will go down because the total count blood cells will come down. So they require monitoring.
Okay. Okay, sir. Thank you. And are diabetic patients more prone for prostate cancer?
What patient? Diabetic?
Diabetic.
Yeah, diabetic are prone for everything, but nothing like, diabetics will have prostate cancer more in number. Or, it has not been proved that, those who are having prostate cancer in the diabetes is found in high incidence. Not at all. Nothing. No
Right.
relation.
Okay, sir.
But diabetics
And
have infection. For prostate problems, they would have more. But otherwise,
okay.
CA prostate has nothing to do with diabetes.
Okay, sir. Thank you. And the next question is from a female. She is suffering from an overactive bladder and wants to know if that could lead to any kind of cancer in her urinary bladder.
Absolutely no. Overactive bladder is just the bladder which is, acting very smartly, acting more. And nowadays, previously there were no much treatment available, but nowadays extremely good treatment is available, pharmacological treatment that is in the form of medicines. And at the
Okay.
same time, all these overactive bladder patients, they need to have, non-pharmacological, like counseling also. Now, like, their fluid intake, they should not be having caffeine, aerated drinks, which will give rise to this frequency and urgency. So all those things, they should see a doctor. Then there are some exercises in overactive bladder also, sphincteric exercises, very well-known exercises called Kegel's exercises, wherein you try to hold, like your anal sphincter, like in
Right.
various kind of yoga, they teach
Yes.
Mula Bandha kind of thing. So
Mm.
that kind of a thing will give some control. But overactive bladder, there is no relationship with, like prolonged overactive bladder would give rise to any malignancy. No.
Okay. Okay. Thank you so much, sir. Would you like to sum up what you want to say just once again for our viewers?
Okay. Now see, the mission is to diagnose prostate cancer early.
Right.
Today in the world, it is a shameful thing that, like in our country, in our part of the country, the diagnosis of prostate cancer occurs late. 70-75% of them, they are diagnosed when they are already metastasized. That is, it is already spread out of the purview of the out of prostate gland. So our aim should be that, and that is why every individual, every male after the age of 50 should undergo PSA test and should see a urologist and get his digital rectal examination done. Second,
Okay.
take home message is if you are diagnosed prostate cancer, after that, you don't have to worry at all good treatment is available. Biopsy is mandatory. People feel that if you do biopsy, it will spread. Not at all. Biopsy is required to plan the treatment, what kind of treatment you want to give, what kind of medicines you have to give, and how bad, good, that is, that as I told you, Gleason score, that is also required to decide the treatment. So biopsy is a must. So these are the things which, and secondly, thirdly, the myth that, like prostate cancer is rare in our continent, that also is completely gone. The fact is that it is significantly increasing.
Okay, sir. Thank you so much and for your time. Also, I think you've been so generous with all your advice. Thanks so much, sir, and for patiently, telling us everything in so much detail. Thanks a lot. Your experience
It was pleasure.
really
It
means
was
a lot to
pleasure
us.
going on this, doing this kind of program, and
Okay.
I appreciate that.
Thank you so much, sir. And thank you, dear viewers, for participating in today's session. I'm sure it was really informative for all of you. For more information and updates, stay connected to our FB page, Prostrate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you all and see you all again. Bye. Thank
Thank
you,
you.
sir.
It was nice to be with you, Sri Devi. You took a
Thank you, sir.
nice interview. It was good.
Thank you, sir. Thank you.
Okay, bye.
Bye.